Peace River North.
Thanks, Madam Speaker. I'm glad to have the opportunity to rise today and support this motion. Like many others in this House, across British Columbia, many of us have personal stories. I myself, many know, lost a brother to addiction, have another family member that is currently in addiction, and it makes it very personal. As substance use in British Columbia does continue to have devastating effects. In fact, as of March of this year, the highest number of overdose calls to police and paramedics happened ever in a 30-day period. The lone day of March 22nd also had the highest number of calls in a single day, with a staggering 205 calls for overdose. The situation is desperate. The substance use crisis has never been more dire in this province. How many people must die, risk brain damage, or go through trauma before meaningful action is taken by this government, before this government starts listening to the recommendations of the Health Committee, to which I and a number of other members sat on. My concerns arise from the serious lack of treatment and recovery services, in fact, in my constituency, and certainly across more rural and remote areas. Just recently, a new supervised consumption site was announced in Fort St. John. Now, we completely agree and support with the full continuum of care, but this government is focusing far too much and far too heavily on harm reduction without focusing on treatment and recovery. In fact, the Canadian government's letter of requirements, which explicitly outlines the work that was supposed to be done as a condition of decriminalization, lays out a set of actions and commitments that were to be fulfilled, such as enhancing the availability of treatment options and guaranteeing that the health and social systems are adequately prepared and equipped. However, that deadline has come and passed, and we have yet to see these guardrails put in place, leaving many British Columbians with no access to treatment. The lack of treatment access is considerably bad in my region, where we have no detox beds or any recovery services in the Northeast. This leaves individuals in my region with only access to a consumption site, but none of the supports that are supposed to go along with that, including resources to support someone through their recovery. Most people suffering from addiction and their loved ones are upset that they are not able to immediately access the services when they need them, where they need them. In fact, the closest resource, which is 500 kilometers away through a mountain pass in Prince George, where many must take this long bus ride to only be turned away in a seemingly never-ending waiting list. The city of Prince George is already struggling to care for its own population, and now it must somehow make room for all northern British Columbians. But as usual, the NDP does not focus, sadly, on the impacts of northern and remote British Columbia. The province is desperately in need of change that would save lives and provide safer communities for everyone. It's why the limited use of compassionate and voluntary treatment will help our most vulnerable youth and adults reach the care that they need themselves to keep others safe. And our Better is Possible, and that is part of our highlights of our plan. Part of the Better is Possible plan addresses the absence of regional facilities. Our plan calls for a minimum of 5 regional recovery communities for addiction treatment where residents can stay up to a year with individualized, holistic, long-term care treatment, including Indigenous-specific care. We propose modernized spaces that provide 24/7 psychiatric and medical support so people are supported every step of their journey. We pledge to work with individuals and get them to a place where they, the public, and everyone is protected. Our plan is even backed by professionals such as the notable Simon Fraser University addiction substance use expert, Dr. Julian Summers. So why won't the government listen? The time for action is now. Honourable Speaker, the substance use crisis has entered its 7th year, and it's clear that doing the same thing over and over again and expecting different results isn't working. We need to recognize that this isn't our new normal, that better is possible for all British Columbians, but only if we try to make those changes. Compassionate and voluntary care can deliver results British Columbians are waiting for, results that the families are waiting for. and most importantly, the results that the individual is waiting for. It's time for the NDP to open resources and deliver the care that people expect.
Thank you, member.
Thank you, Honourable Speaker.
Thank you.